So there are many things that you can do to help prevent a heart attack or heart disease. In this video, I'm going to share with you my 7 top tips to help protect your heart health. Oh, and by the way, make sure to watch to the very end because I'm diving deep into the do's and don'ts of heart healthy foods as well. So let's start off with tip number 1. I think this one is pretty fascinating and not a lot of people know about it, and it's oral health. I know it sounds random, okay, when it comes to heart health, but there's been a lot of studies that have shown a massive correlation between poor oral health and increased cardiovascular risk, as in increased heart attacks and strokes. One theory suggests that the bad bacteria in the mouth from bad oral hygiene can travel into your blood vessels and cause inflammation, which then increases your risk of heart disease. And so there's multiple theories as to why this is happening. So more researchers needed to understand the exact reason why, but one thing is super clear: maintaining good oral hygiene, good oral health. So brushing your teeth, flossing regularly, having regular dental checkups, not smoking. So good oral health is linked to good heart health. Moving straight on to tip number 2, maintaining a healthy weight is vital for heart health, okay? So if you've got increased fat around your waist, or if you've got dangerous visceral fat, it's going to increase your blood pressure, going to increase your cholesterol, and increase your risk of type 2 diabetes, all of which make it more risky for our heart health. Waist circumference is a really useful indicator for belly fat. So in terms of numbers, a waist circumference greater than 40 inches for men and greater than 35 inches for women increase our risk of heart disease, okay? So we need to lower it. And also, any weight loss, okay, is beneficial to help protect our heart. 3 to 5% weight loss is very, very good in terms of risk reduction. And by the way, that weight reduction only applies if you are overweight, of course. Now, if you are someone that's wanting to lose a bit of belly fat, do check out my very own diet, the Abraham diet. It's simple, it's effective, and it can help you lose 1 to 2 pounds per week and up to 5 centimeters off your waistline. It's helped over 25 million people around the world who've watched the video. I will leave a link to it in the description. Make sure to watch it after finishing this video. Straight on to tip number 3, blood pressure. I'm going to make this very simple. You need to have an average blood pressure of 130 over 80 millimeters of mercury. If it's lower than this, great. If it's any higher than this, and you're constantly seeing that it's higher than this, it's putting pressure on your blood vessels, it's putting pressure on your heart, it's putting pressure on your kidneys, all of which are going to increase our heart risk, okay? So if you know this is higher, speak to your medical provider. Moving straight on to tip number 4, cholesterol. And we are focusing specifically on low density lipoprotein cholesterol, which we call LDL-C for short. Now, if you have no history of coronary heart disease or stroke, you should be aiming to keep your LDL-C below 100 milligrams per deciliter if you're watching in the US. In UK, we have a different unit, and it will be 2.6 millimoles per liter. So you need to aim to keep them below that. Now, here's the thing. Some guidelines may allow a slightly higher level for those patients who are at lower risk. However, maintaining your LDL-C at a lower level, like what I've mentioned, over the years is going to benefit you a lot. It's going to reduce the risk of plaque formation in your arteries, which is overall going to help reduce your risk of coronary heart disease and stroke risk. Now, for both cholesterol and blood pressure, I do have videos on how to naturally lower them, so definitely do check them out at the end of this video, which moves me on nicely to tip number 5. Make sure you're having regular health checkups with your medical provider. So they're doing your blood pressure, they're doing your bloods and checking your cholesterol, they're checking for type 2 diabetes. All of these increase our heart risk and increase our risk of heart attacks and stroke. So next up, let's talk about health checkups so you can monitor important stats like your heart health and dangerous visceral fat. I've been using the body scan. This is a health scale by WITHINGS. I've been using it for the past few months and cannot recommend this revolutionary device enough. You simply stand on the WITHINGS body scan, you hold onto the handles, the device then scans your body in 90 seconds. And during this time, it conducts an electrocardiogram, it measures your fat and muscle percentages, it tracks progress, and it can detect early health concern signs that you should speak to your doctor about. Now, the WITHINGS products are backed by doctors and medical experts. They're very good friends of the channel. I love their products, but not only that, I love that they prioritize preventative health, which is fantastic. To learn more about WITHINGS, I'm going to leave a link to them in the description below. Do check them out. And WITHINGS, thank you for being our trusted sponsor. Moving straight on to tip number 6, exercise is great. Physical activity helps strengthen the heart, it helps lower blood pressure and lower cholesterol. But combine this with healthy eating, okay? 2 examples that come to mind are the DASH diet and the Mediterranean diet. I'm going to leave lots of tips here. Pause it now, give it a read, take a screenshot so you remember for later as well. And straight on to tip number 7, sleep quality. Aim for 8 to 9 hours of good quality sleep every single night. If you are someone that's always feeling tired, even though you're getting 8 to 9 hours of sleep, speak to your medical provider about it. Sometimes some patients have something known as sleep apnea, where it causes them to stop breathing during the night, and this is massively linked to heart disease. So this is something that you should always speak to your provider about. I really hope that these tips in this video were helpful. Sending awesome vibes.